For the next portion of our presentation, Anna and I will be presenting on equipment and technology for everyday life. This is not meant to be an exhaustive overview of everything or to make everyone here an expert in everything that's out there. We have a good sense of what's out there. We've seen a lot of things. We've tried a lot of things. We have Rush with us today also, who will be sharing some assistive technology and adaptive equipment that's available for folks to try here in St. Louis. He's actually got a table outside that you can check out. I would encourage you to do so. But we'll be talking about technology and equipment that may be helpful in different situations. Disclosures, we have no relevant financial and non-financial relationships to disclose on the topic. My one big caveat is that images that are presented on the following slides, as well as anything that we display or demonstrate during the session, it's really just meant to support discussion and understanding. These are images that are meant to serve as examples. I did have to give image credit because I don't own all of the images, but just ignore those completely. We do not intend to indicate endorsement or specific recommendation by ourselves or by Children's Hospital of Philadelphia or UT Health Houston. So this is just for the purposes of discussion. And of course, you recommend that anyone interested in pursuing orthotics, bracing, equipment of their own work with their providers to determine what is best suited for them and their needs. Objectives for this portion of the discussion are to develop an understanding of the different types of bracing equipment, orthotic, mobility devices, assistive technology, so many words we can use, but really how these devices are used to support improved mobility, physical function, and access to different environments. Right? Our goals are to improve function and participation in meaningful activities in everyday life, and technology can sometimes be really helpful in providing that access. I also wanted to clarify some of the nomenclature and just demystify some of the terminology surrounding these things. Sometimes these terms get used interchangeably. Bracing in particular can seem like alphabet soup, SMOs, AFOs, MAFOs, like what are all of these letters? What do they mean? Even as a new PT out of PT school, quite some time ago, I didn't have a great handle on what all of it meant, and it took a little while to understand all these pieces and how they come together. This will be kind of like bracing and equipment 101. It's really just intended to make you and the audience feel like you have a better understanding of what these things mean when providers are talking about them. If a therapist is discussing implementing something or trying something, that you have a little bit of background into what that might mean. Even providers sometimes use the terms interchangeably or incorrectly, so it can become a bit confusing, and I want to make it a little bit easier for everyone. All in service of supporting collaboration with your own providers when pursuing bracing and equipment. So we'll start with orthotics and bracing. This will be a very, very short anatomy discussion. This is a leg. And we will talk about levels of bracing based on the different major joints of the leg. So the knee, the ankle, the foot is a little obscured by the captions here, but knee, ankle, foot, and then actually can we move, I don't know if we're able to move the speech bubble again. I was just gonna point out a couple of bony prominences at the foot. You do not need to know the neuroanatomy, you do not need to know the muscles. I have just a few more little tags here. The malleolus or the malleoli are basically the bumps on either side of the ankle. They're part of comprising the ankle joint. The subtalar joints, which you may have heard of in terms of pronation, supination, that's the joint that allows for movement in and out or toward a flat foot position or that inverted or kind of rolled ankle position, and the calcaneus, which is your heel bone. I might use those terms while we're discussing bracing, but if you understand knee, ankle, and foot, I think that will be sufficient for today and will help with the terminology. So one type of bracing or orthotic that we might recommend in clinic for a variety of different reasons would be a functional foot orthotic. A functional foot orthotic is an orthotic that helps support the foot, typically the arch of the foot. Some styles have a bit more of a heel cup, for the calcaneus or the heel bone to control the position of the heel and control some of that pronation and supination that you might see. So we might recommend functional foot orthotics for a patient who has flat feet, particularly if the flat feet are painful. Many individuals in life have flat feet, but they are flexible, they are not painful. You don't need orthotics if your feet are not painful and are not causing you any difficulties in terms of gait efficiency or physical function. But we might recommend a foot orthotic in some cases. These are just some examples of different non-custom and semi-custom foot orthotics. Of course, custom orthotics are also available. The device or orthotic on the right is a UCBL, which is the only one that doesn't really fit the alphabet system very well. So FFOs, generically functional foot orthotics. The UCBL is the University of California, Berkeley. Oh, I'm blanking on the L, Stephanie. But California, Berkeley, staked their claim on that one. But it is a slightly different type of foot orthotic with higher trim lines. But if you hear functional foot orthotics or UCBLs, these are the types of orthotics that are being discussed or recommended. The nice thing about some of these being non-custom too is if you're working with a therapist or an orthotist, they might even have a pair that you can kind of see and feel and check out in that process before making a decision, whereas the UCBL is typically more custom molded. Next, we have SMOs. So we're working our way up the leg from the foot to the subtalar joint. The SMOs are supramalleolar orthosis, above the malleoli, above the bumps on either side of your ankle. These braces are going to control more of that pronation, supination motion. So we tend to recommend these for patients who have a lot of extra motion in that direction at the ankle. Maybe they're kind of rolling onto the sides of their feet, or they're very excessively pronated. Our patients with low muscle tone, who are ambulators, or maybe young children who, because of their lower muscle tone, because of excessive joint motion, are having trouble getting into a stable base of support for standing and walking skills. We've had some really nice success with these lower level bracing just above the malleoli. These fit into a sneaker. I should have said that for the functional foot orthotics. All of these go into a sneaker or a shoe. They can't really be worn on their own. That helps complete the bracing system and keeps everything nicely contained. But these are just some different examples of what an SMO might look like. Some have longer toe plates, some have a shorter toe plate, but what they have in common is that they're giving some control of that pronation, supination, and also providing some sensory input and some containment at the lower leg, which can help patients stabilize, both to feel more stable while standing or more efficient while walking. We're continuing our adventure up the leg. So now we're going to talk about ankle foot orthotics, AFOs. AFOs control the ankle in that sort of forward and backward motion. So not just in and out, pronation, supination. It's probably more helpful if I don't know how well people can see my feet because I'm short and there are chairs. But for the ankle joint, AFOs are going to control the forward and backward motion at the ankle, or what we call plantar flexion and dorsiflexion. On the right here, we have two examples of a solid AFO. So this provides a lot of stability, but whenever we provide stability, we take away some mobility. So a solid AFO works well for an individual who maybe has sufficient or, well, enough weakness at the ankle that they're not really able to control themselves in a standing position, might be at risk of buckling, or if there are other features like increased tone or spasticity, where maybe we want to just get a really nice hold of that ankle and help support the ankle in a neutral position for foot clearance. These are both solid AFOs. One of them has an SMO inner boot, so a supramalleolar inner boot that just gives a little extra support to the foot and ankle complex. But they essentially serve the same function of providing a lot of stability at the ankle. For those who have more motor control, who are not at risk of buckling at the knee, one option that we could recommend would be an articulating AFO. So these two examples, there's really 3 braces shown there. These are articulating AFOs, which means they have an articulating joint. They allow free motion. That motion can be adjusted to allow more plantar flexion or more dorsiflexion. Typically, we're allowing for dorsiflexion so that the individual can translate their leg over their foot more efficiently while walking. So the cute one, I think with Tweety Bird on it, on the right there, is actually somewhat in motion. You can see that hinged brace. But typically individuals have to be a bit stronger to have a free ankle joint or a more mobile ankle joint in their brace versus a more stationary, more supportive joint. So for folks who are using standers, for example, but are maybe not ambulatory, we'll typically go with a more solid AFO just to give good support in a standing weight-bearing alignment. For someone who's ambulatory, we may be thinking about solid versus articulating, depending on their abilities and safety, ultimately. I'm going to say one more thing about for the plastic AFOs that I just showed, the other name up there was MAFO, which gets used at some institutions. That just means a molded AFO. It's a plastic AFO that has been molded to fit the leg. So MAFOs, AFOs, basically the same thing. MAFOs are a type of AFOs. One other type of AFOs that we're using more and more, these are a bit newer in the grand scheme of things, are these carbon fiber AFOs. These were originally developed for individuals with relatively isolated foot drop or ankle weakness that was making it difficult to pick up the foot while walking, but still with sufficient strength up the chain to not need something as sturdy as a solid AFO, like we just saw. These also have more kinetic properties to them. They're made out of carbon fiber. They store some energy. They actually kind of help spring the foot to lift it as someone's walking, particularly if they're able to bring their entire body over their leg. And then the brace helps to lift the foot. So they can even be used in sports, for example. These are sometimes a really great option for our patients who are able to ambulate independently, but maybe find that they do have some foot drop or tripping when they get tired. Or patients who are wanting to participate in sports, but maybe need a little extra support to perform at that higher level. So I love that there's an individual running in them here. These ones certainly have to be worn with shoes. You can see that there's not much other support to them other than that foot plate to help lift the leg. They come in a few different styles, in front of the leg, behind the leg. I think there's even some that are a little more lateral or to the side of the leg with the strut. They're lower profile than the plastic ones. So we talked about being flexible as a therapist, and sometimes the best recommendation is the thing that works best for your patient or family. I have a number of patients, I'm thinking of my teenage patients especially, maybe aren't comfortable wearing a big plastic brace to school. And even though this one's not quite as supportive as a plastic AFO or a molded AFO or a MAFO, depending on who you're talking to, the carbon fiber is a little sportier. It's a little more appealing. It's lower profile. It's easier to wear under your pants where no one can see it. And so we might add a little additional support in those situations, like on the far right here, a UCBL or an SMO. These are tools to help with mobility. And so sometimes we have brace users who wear one type of brace for one activity, another type of brace for something else. Maybe they're wearing their bracing if they're going on long walks or participating in a lot of activity, but they're not wearing anything at home, or they're wearing something lower profile at home. So I would encourage everyone to think of these as tools that serve a functional purpose and participation in everyday life, and not necessarily something that has to be worn all the time, every time. These ones are pretty nifty. One other category or family of AFOs that we will use and recommend with some frequency are these, quote, night stretching AFOs. I call them night stretching colloquially. I think it's pretty common to call them that. You don't have to wear them at night, but they are for stretching. So this is a hinged AFO with tension straps that can be used to apply a stretch at the ankle. So we recommend these for individuals who have tightness in the calf muscle, tightness that's affecting the range of motion at the ankle, the mobility that they have. Commonly we'll see like a toe walking position, or sometimes patients are unable to bear weight effectively because they have so much ankle tightness. They're not able to get to a good stable flat foot position. The other reason we really care about ankle flexibility as therapists is you use your ankles to help keep balance. You need some motion at your ankle to react to a perturbation or a change in position. And when there's ankle tightness or there's difficulty controlling the muscles of the ankle, it can place folks more at risk of losing balance or not being able to react to something. So we like to have flexible ankles. I think we have a pretty low threshold for recommending these at CHOP if we perceive any ankle tightness, even if you're just kind of tight in a neutral 90-degree position. We want you to have a little more than that. For walking or for standing. So for individuals who are maybe not ambulatory or no longer ambulatory, but who are still participating in standing activities in a stander, we want you to be able to get to a good flat foot position so that you can bear weight in a comfortable position and tolerate that stander. So sometimes we're recommending stretching bracing in addition to the bracing that would be worn during an everyday activity, such as standing or walking. There's a couple different styles. So this one has stretching straps. These two on the right here both have a tension joint. It's an adjustable dynamic joint, so it can provide some tension, some additional stretch. And that tends to work a little bit better when there's increased tone or spasticity. So a couple different options. The night stretching thing, we call it that because if you can wear the brace overnight, you're gonna get 6, 7, 8, 10 hours of good stretching. What's necessary to change the muscle to actually make it longer, because it's not like you're stretching a rubber band where it's gonna snap back into place. You're actually looking for a low load, long duration stretch that puts the muscle in a stretched position, but that muscle actually grows longer and then has more flexibility from that new end point. So we're physiologically trying to change the muscle with long duration stretching. It's why we love it if people can wear these overnight. Most of our patients, especially our younger patients, don't want to wear them overnight. It disrupts their sleep. They want to take them off. They're hot, they're sweaty, not a fan. We're always happy to work with you to figure out strategies. Does that mean you wear one at a time? Do you wear them while you watch a movie instead? Do you wear them while you do your homework? You don't actually have to wear them at night. The goal is just to get longer duration stretch whenever you can. And it can certainly take some time to build up a tolerance to them. But we do recommend those with some frequency. We don't order CAFOs that often, occasionally in certain cases, but working our way up the chain, right? We've talked about foot orthotics, supramalleolar orthotics, AFOs, ankle foot orthotics. Now we're talking about KAFOs, which is going to be a knee, ankle, foot orthotic. So this is a longer brace. This gives control at the knee joint and not just at the ankle. But we do sometimes order these in a stretching context. If there's tightness at the knee that's making it difficult to extend the knee or preventing knee extension, you may hear that referred to as a knee flexion contracture. The knee is contracted in a flexed position. We might order a stretching CAFO or a stretching KAFO. And in some cases of significant weakness, we might use a CAFO for standing, but not as often. Any questions about bracing? It is like alphabet soup and it's hard to keep track of sometimes, but yeah.
So I have just a question about the, specifically for the full foot or the FFOs, which provider, is it physical therapy or which provider would order those because I feel like I don't have a gait assessment particularly frequently at the physician's office, and currently my physical therapy is just at like a, normally they do like the post-surgery type rehab, so they haven't done any sort of mobility device or support assessment there either.
So physical therapists can assist with ordering them. We typically collaborate with an orthotic provider or an orthotist, the same folks who might make a higher level brace. Frequently at CHOP, we'll have orthotists join a session. They do require a prescription from a physician typically, so you might just be asking for a script for a functional foot orthotic or an orthotic assessment. We've had some of our physicians at CHOP, for families who aren't as local, just provide a script for orthotic assessment, and then the patient can go to an orthotist directly in their community to get assessed for a foot orthotic.
Okay, thank you.
Yeah.
It also is sometimes dependent on your insurance. Some insurances will not cover orthotics below the malleolus. So sometimes like the orthotists that we work frequently with at CHOP will say this will actually be cheaper if you just order directly from the website. So just kind of check on that before and work with your PT and orthotist on that.
Yeah. Yeah, and we've been fortunate, certainly the orthotists that we collaborate are usually happy to do the consult, and if they check it through insurance and it's not going to be covered, they'll give you the information so you can just order it online yourself. But they're happy to give that clinical information and then give you the information to order if needed. All right, we will be talking about mobility devices next. I'm not going to spend much time talking about assistive mobility devices that are more commercially available that I think a lot of us are already familiar with, such as the rollator walker or four-wheeled walker, canes, anterior rolling walkers. So these are like metal frame walkers that go in front of the body, or like a typical loaner wheelchair, transport wheelchair, something that's maybe easier to obtain, but also I think just more something that everyone's a bit more aware of in general. I do think these can be good options, certainly, if someone is needing a lightweight, simple mobility device that they can use in certain circumstances. They're relatively quick to obtain. A lot of these are available on like Amazon or through Walmart, CVS, Walgreens, things like that. So if you're looking for a little something for balance in certain situations, like you're going somewhere very busy, or you're going to be on your feet a little while and just need a little something for extra balance when you're fatigued, these can certainly be good options for our patients. I'm going to spend a little bit more time on the things that look more and are classified more as medical devices that need to be typically ordered with a script or usually a letter of medical necessity, often through an equipment program or a vendor. These are posterior walkers. So in contrast to the more familiar anterior rolling walker, the frame of these devices actually goes behind the user. They're a little bit sturdier and more supportive and more efficient. And more customizable. So we really like these for patients who need some support for balance while they're walking. That may be over long distances, it may be all the time, maybe it's at school. But we really like these devices for balance and safety if some assistance is needed to walk. It's relatively light assistance compared to some of the other devices that we'll talk about. So we would consider these a handheld mobility device. I think of my kids or my patients who are able to walk with their hands held. They're maybe not needing a tremendous amount of support. They just need a little something to hold on to. As a PT, I also like these more than the anterior rolling walker. They're providing support in a way that encourages the user to stand a bit more upright. They're still using their glutes and some of the muscles that we would want them to use for a more typical walking pattern. And I think this is more sustainable and comfortable long term. They do come with the option for seats. So there's like little flip down seats. Some of the models in particular also come with like a little trunk support. So you can actually add support to these if someone needs a little bit more than just the handheld component. but it also means that they're fairly adaptable. So these can be nice devices where maybe someone needs a little more support for a while and then you can take it away. Or maybe you're thinking we might need a little more support over time, so let's get something that we can add supports to if needed. If there's an acute change, maybe we add some support, and then as there's recovery, maybe we can take some away. So flexibility is nice with these. They're fairly adjustable and can grow with patients over time. And for kids, I also love that they're pretty free and unrestricted in the front. So patients can just walk one of these right up to a table and play and then walk away when they're ready. So there's nothing really blocking the user from accessing their environment in front. Gait trainers, in contrast to posterior walkers, these look a little bit more intimidating. They look a little bit medieval sometimes. They're very bulky. But the big difference here is these are providing more support. These are providing trunk and pelvic support beyond just a handheld mobility support. I have some pictures of folks using them in the next slide because it can be a little difficult to tell what's what. But these can be really, really wonderful devices for allowing folks to stay active, to exercise, to walk, to get weight bearing, if they need more assistance to support their body weight. These tend to have a frame in the front. There are some models that will allow you to flip it around so they're a little more open in the front, kind of like a posterior walker, but still with full support. And these can be customized with as much or as little support as needed as well. So these can include like a head support or prompt, different types of arm prompts, so things to grip, platforms to rest on, many, many different options. And these also tend to grow or adjust with age as well. I've even used these with adults who just wanted a way to safely exercise on their feet, but were unable to do it unassisted. One nice advantage in some ways to having the frame in front too is if a child is using one of these, they're not really gonna run into anything, right? The gait trainer is gonna run into something before the child does. So it sometimes gives them a way to be a bit more mobile, but inside of a safe frame and a supportive device. One other thing that I think about with these too, sometimes when I'm between a posterior walker and a gait trainer and I'm thinking about support, the other thing I'm thinking about is seizures. So I do have some patients who have the physical ability to use the posterior walker, but if they have seizures that cause them to drop to the ground unexpectedly, even though the gait trainer is a bit more restrictive because it's adding more stuff, it's adding more support, it might actually be the safer, more independent option because it's not going to tip over. The posterior walkers can tip a bit more easily. Sometimes that's just a conversation of, do we want the lighter weight posterior walker type device, but we still need to have a caregiver or a helper within arm's reach in case of a seizure? Or do we have something a bit more supportive, arguably a little bit more restrictive, but then the user of the device can be line of sight supervision and has a little more freedom to move about the room? So those are the things that we think about and really partner with families to try to pick what's right for them. I will say one other thing really quickly about gait trainers. There are a couple of models or schools of thought in the therapy world. One is that the user of the gait trainer is learning how to walk reciprocally, one step and then the other. The other line of thought is if it gives you freedom of mobility and you are able to move across the room, you are able to access your environment in it, a child is able to propel it in a purposeful way, it's good enough. Get the device, let them play, let them move. I'm in the second camp. I don't feel like my patients have to walk perfectly one step and then the other before ordering. If I see meaningful active propulsion, if I see enjoyment of the physical movement that's self-generated, I'm gonna try to order the device. So I'll just throw that out there. You don't have to walk one step and then the other in order to propel yourself in a meaningful way to access your environment. So if you're hearing that from therapists, I would encourage them to think of it in a more holistic, more functional way. You can always work on one step at a time in the future, but I would never want to delay getting a child a device if they're able to use it in a way that's meaningful and functional for them, even if it looks a little bit different. So here we have some gait trainer users, just to see what those devices can look like, and just different examples of trunk prompts and pelvic prompts. Gait trainers and walkers, I think, are the terms that I often hear used the most interchangeably. But the big message there is the posterior walker is a handheld mobility device, and the gait trainer is providing trunk and pelvic support, or one of the two. Standers or standing frames are really helpful for achieving weight bearing for individuals who are unable to bear weight on their own, or individuals who aren't able to propel a gait trainer or a personal mobility device. We know that weight bearing is really beneficial for bone health, for hip joint health, for GI function, for respiratory function. So there's a lot of great reasons to help folks spend some time in standing or weight bearing every day. The goal that we typically recommend is an average of an hour a day, which is something to work up to. But there are different standing frames and models available to help meet that goal. This is also something where in therapy we might work with a family and a patient and have them try a stander several times in some different therapy sessions, see what models work well for them, see what fits, see what they're comfortable with and what their family is comfortable transferring them in and out of. So these are just my 3 initial examples. One thing I wanted to point out, there's 3 main styles. So there's prone standers, where an individual is placed on their belly in prone in the stander and positioned. This requires some degree of head and upper trunk control to be comfortable for an extended period of time. There's a supine stander option, so this can be moved up to a standing position, but the individual is placed on their back, and that's safer and more sustainable for someone who has trouble maintaining their head upright for long periods of time. The standers also don't have to be fully upright to get some weight bearing, so even being at a 45 or a 60-degree angle for an extended period of time is still conferring some weight bearing benefit. And then perhaps one of, probably the best option if transfers are difficult is a sit to stand type model where the individual is transferred in a seated position, so just a pivot transfer often, into the seated position in the stander, the supports are secured, and then the stander actually has like a pump handle or an electrical switch to help move it to an upright position. So that can be a great option for adults. I'll speak briefly about transfer equipment, the thing that we end up recommending with some frequency, especially thinking about long term as patients and individuals are growing, and if a caregiver is needing to assist, would be something like what's typically called a Hoyer lift. There's many brands and options, but the idea is a sling and a mechanical lift to make the transfer easier for everyone and protect caregivers as well. So we're not just treating the patient, we're also thinking about the caregiver's safety. We want to be sure that everyone's back stays nice and strong and healthy and there's no injuries along the way. So as patients are getting older, we will sometimes think about a Hoyer lift if assistance is needed for transfers. Wheeled mobility, many options out there. These are some more custom options than the chair that might be purchased like from Walmart or used at the airport. Lightweight manual wheelchairs are really great for folks who are using wheelchairs long term. They're easier to propel. It's a more custom seating setup, and these can be grown with patients over time. We've had very young patients be successful with wheelchairs. Both with lightweight manual wheelchairs and with power or power assist options. There's a tilt and space wheelchair here, which is going to provide more support for the head and trunk for someone who needs a higher level of support and who is primarily being pushed by a caregiver. And then power options, there's many options abound, different types of seating, different mechanisms for operating the power wheelchair. These are things that we always encourage folks to go through an equipment clinic to pursue versus asking a physician to just write a script with the details on it. Equipment clinics are where therapists work really closely with vendors to determine what's the right setup for you, what are the right options, and especially if insurance or you are paying for a piece of equipment that costs many thousands of dollars that you may only be able to get once every however many years, we really want to be sure that that's done properly. So power can be a great option for folks. We just want to be sure that it's done well. And there's even some pediatric options now, as well as some options for what's called power assist, where a power assist unit can be added to a manual wheelchair so that someone who is self-propelling gets a little boost to make that self-propulsion a little bit easier over the course of the day. And there's several different options for that as well. I'll touch very, very briefly on adaptive equipment for exercise because Steph already covered some of this, but thinking about ways to stay active even at home. So an under-desk pedaler, which can also be used as an arm bike on top of a table, an under-desk elliptical. We love all of the regular gym equipment too, but if balance is an issue, I'd probably recommend more seated activity, like a seated elliptical or a bicycle type activity. Big fan of adaptive sports for patients who are interested in participating. It's a great way to get out in the community. And keep in mind that someone might use one type of device or equipment depending on the activity. So we have folks that might be using a wheelchair to participate in sports from an endurance and balance perspective, but they might be using different supports in their everyday mobility. And there's some really cool assistive technology and adaptive equipment for sports participation as well, such as the sort of bike running device shown at the top there. And then it's cut off there at the bottom, but that's a picture of a swimming pool. We love a swimming pool. I don't know that I'd consider it equipment to pursue, so to speak, but thinking about changing the environment to make exercise more successful and sustainable for a lot of folks.
Okay, I'm just going to jump in and go over a few types of equipment that will help you with those occupations or those daily living skills that we address with occupational therapy. So bathing and toileting equipment. I'm going to try to get through this more quickly too because we actually have another speaker today who's got some cool stuff. So our friend earlier was talking about her shower chair and having the option to sit when you bathe. Something as that can help greatly with energy conservation, prevent falls, prevent injuries. Something like one of these is, for smaller kids, if they can't quite sit up on their own, but you want to get them into the bathtub and have them be safe, those are options there. Adding things like grab bars can be super helpful. And then down here in the corner, that pink chair, there are options for like chairs or things that can be put down into the bathtub where they've got sort of a mesh material where if you've got someone who can't sit up on their own, an option to get them in the bath instead of doing something like a bed bath. And there's lots of options for adding things for positioning, if they don't have head control, if they don't have trunk control. Those are more of the customized things that you would work with a vendor to find the best option. Or something more like this that could go over a toilet, but also go into a roll-in shower. This one tilts back, has the head support, again, for maybe somebody who is a bit larger than a smaller child, to be able to get them in and out of the shower. Or something as simple as a bedside commode or drop arm commode, things that you can put over the toilet or also have in a different room if you have a hard time getting into the bathroom. Or something as simple as a raised toilet seat. I did that 60-second sit to stand in the Coast at the Research Pavilion, and when you're standing from a lower surface, it takes a lot of proximal muscle strength, right? So if getting on and off the toilet is difficult from a standing perspective, something as simple as that from Amazon, CVS, getting the toilet seat just a little bit higher can make life a lot easier. Adaptive seating. This would be for someone who wants to get, maybe if they're using a wheelchair, but needs to get out of the wheelchair throughout the day, just like I would sit on the couch, this would be for somebody to sit for a more prolonged period of time that maybe needs a little bit more support. So again, tons of options, tons of variability, depending on what the needs are. Just throwing these out there so you know that they're there. Sometimes insurance doesn't cover these things, but if you have waiver programs or things of that nature, I know a lot of people use their funding for that, to have that as another option rather than being either in the bed or in the wheelchair all day. And then adaptive car seats. There are car seats that these would be more for people who have outgrown the standard commercial car seat, but still needs the support that a car seat provides. They make different brands that go up to supporting people of fully grown adult size. So I think safety during transportation is something we kind of forget about or like don't talk about as often as we should. So just knowing that there's options out there. This one swivels, so getting in and out of the car can be a little easier. They can provide head support, trunk support, especially for driving those longer distances. I live in Houston, so during that commute, if you have a kiddo who can't hold their head up and then they're just in this slouch position for that hour-long drive to the medical center to see us and to see their physician, that can have some long-term implications. So for people to be safe during transportation. And then aids for daily living, and so we'll kind of transition into Rush here for a little bit. There are a ton of things out there that can just make your life a little bit easier. Adaptive equipment to make eating easier, to make bathing easier, all of those daily living skills, and I couldn't even come close to covering all of it. So these are just some examples. This is a sock aid, a long-handled shoehorn, a reacher so that you could just pick something up off the floor without having to bend over. Long-handled sponge in the shower so you don't have to bend over as far if you have trouble reaching your feet. Different types of utensils or things that you can add to utensils to make them easier to hold. These are weighted utensils. If you have more of a tremor, sometimes adding weight either through the utensil or putting wrist weights. There's some fun, fancy wrist weights out there that can help with that tremor during feeding, all the way up to high-tech stuff like the Obi, which Rush has at his table to demo. So I don't know if you want to come back and go over the conclusions at all. Basically, you've heard us say there's tons of options. This was just a very quick, as quick as we can make it, overview of some of the bracing orthotics equipment. There's off-the-shelf, custom, all the options out there. We could have done a whole day on this topic, so trying to pare it down was a little difficult, but the main thing is we want people to improve their function and participation in everyday life, and there's things out there to make life easier, to meet your needs where you are. And then just consult with your medical team, consult with vendors, providers, people that are gonna know you or your child or your family member, work in collaboration with your therapists and the equipment vendors to make sure that your needs are being addressed appropriately. Like Stephanie said, yes, Stephanie. I just blinked on you. No, Lizzie, I just blinked on your name, sorry. So like Lizzie said, we're not recommending anything specifically, but just wanted to throw some things out there that you may not know existed or things that you can ask your providers questions about. Do you have anything to add on that? Okay, sorry. And then before questions, Rush has a little bit of a demonstration. Can you hold that question for just a second? I want to make sure that we give him the time that he needs as well. So we got the other presentation.
Hello, my name is Rush. I work at Paraquad. Just a brief history about me. I had suffered a spinal cord injury when I was 16, so I know the importance of adaptive technology to make your quality of life a lot better and easier for people. I am a sex ed teacher for youth and adults with intellectual disabilities. I work with ADA. Paraquad, we offer a wide range of services for people with disabilities. So Paraquat is a service at Independent Living Center in St. Louis. We work with youth, adults, people who are aging into disabilities. We offer a lot of advocacy services and also like job skills, job coaching, just for people who want to get back to work. Caregivers, just a lot of big wide range for things like that to help people be more independent. So like they said, to everyday living, a lot of people doesn't think of adaptive technology for everyday living. They just think of it as more high-tech things. But as you see in the pictures, it can be everything from bathing, going to the bathroom, feeding yourself, and also education. So at Paraquat, we like to tell people that come and tell us your needs, and we will find a specialty device for you. It can be something as simple as just a universal cup to help you be able to type on your computer if you can't hold it, like if you can't type. Stick a pencil in it, you can just tap on it. Or something more high-tech as something that's having a drag-in dictator on your computer. If you have a learning disability and you have trouble with spelling, you can just talk it out like that. So the Stephen A. Orthwein Center, it's a gym specified for people who do have disabilities for all ranges. And it does have physical therapists and occupational therapists. As a lot of people know, once you go to a rehab facility, as soon as you're getting better, they kick you out. So it's like, oh man. So you can come to our gym, and everything's modified for people who do have disabilities, so you can continue your progress and also be able to get stronger and be more independent. Being physically active. So, like I say, it helps you get stronger, be more independent, stronger, continue your quality of life, just being able to not get so fatigued. Also, just doing something simple as being able to roll around or walk to the refrigerator, that's part of being physically active, and it helps you out too. So this, okay, oops, can you go back? Okay. So, okay. So also at the gym too, we have a lot of high-tech equipment too. So if most of the equipment helps people who have brain injuries, paralysis, cerebral palsy, or neurological disabilities, even strokes. So we have a lot of high-tech things too. So all these, show a quick video, and these videos will show you the different technologies out there for people who have all disabilities and how therapists can work with you. And also just, there's a lot of things, just really what's out there to help people out. So this is a quick video for you. Okay, so the gym, we offer a lot of different equipment like that too. So it can be work with people who have neurological spinal cord injuries, cerebral palsy, and just let you know what's out there. It's not just, and also the gym is mainly for people who have disabilities. Like all their equipment, you can just roll up to it. And like that's a lot of issues that people who have disabilities face when going to the gym. Their equipment is honestly just not accessible, or the staff just doesn't know how to work with people who have disabilities. I'd also like to let people know, be advocates for yourself too. So that's another thing with adaptive technology. It can help you advocate for yourself. If you're in school, I need something to help me be able to see the computer screen or be able to write. So we like to tell people adaptive technology can help you advocate for yourself and just make you feel more independent. And also independence too. Something as simple as being able to brush your teeth. That is something that a lot of people take for granted. So if you have an adaptive device, something as simple as a universal cup to help you be able to brush your teeth, that would make you feel more independent and also make you feel good about yourself. Also something simple as being able to turn a book, read, like I said, we have a lot of different devices, even free apps on your phone that help you be able to read. It reads it out to you if reading is a trouble for you. So also a reasonable accommodations with adaptive technology. Something as simple as telling people, hey, would you mind bringing down the menu large print? That's accommodations for you. Even Braille, things like that. Also, just like say certain places doesn't have easy push doors. So something as simple as that too can help people be able to accommodate themselves. Also confidence. Like I say, having the confidence too with adaptive technology to be able to roll, to be able to just to go out with your friends, like she said, the push assist, smart drive, that'll help you just be able to go out to a concert without getting fatigued. Also just walkers, things like that can help you out with adaptive technology. Let people know the importance of being confident, because we work with a lot of people who lose confidence when they're not able to just spend time with their friends. So adaptive technology and just things like that will help you be confident.